Well, women who are facing surgery to treat breast cancer have choices when it comes to the type of breast reconstruction that's available to them. Joining us now to explain the different options is plastic surgeon Dr. Mitchell Brown. Great to have you with us this morning.
Great, so nice to be here. Thank you.
Yesterday on the show, I spoke with a woman who had or wants to get her breast implants removed after she had a double mastectomy because there's a possible link to cancer with her particular implants. So more broadly, what are the options that women have after, for example, a mastectomy or even a lumpectomy?
Sure. So we'll talk first about mastectomy. When a woman has a mastectomy, the first conversation is really about whether she has an interest in having reconstruction or not. We always want to talk about breast reconstruction as being an option or an alternative. There's absolutely no reason why somebody needs to have reconstruction, but for quality of life reasons, many women choose that breast reconstruction is something that they wish to pursue. And I think for those patients, it can be a very gratifying and a successful procedure. Generally, we think of breast reconstruction as having two types of options, either with the use of breast implants, and that is likely in North America the way that it's performed about 70 to 80% of the time, for a whole variety of reasons, not the least of which, it's the easiest to be able to take an implant and place it in this area rather than have to go to another area of the body and take tissue from somewhere else and move it. So the second way to do reconstruction is to take tissue from somewhere else, skin and fat from somewhere else on the body. Probably the most common area to do that is from the tummy, very similar to the tissue that you might remove if you were having a tummy tuck. But instead of discarding that tissue, being able to take that tissue and move it from the tummy in a kind of a fancy way up to the chest and use it to shape a new breast.
So with the doctor, how would you determine which option would be best for you, whether it's an implant or whether it's using your own tissue?
In the end, it always comes down to patient choice, but some patients are better candidates for one alternative or another. For example, many women who have mastectomies may be very thin. They may not have very much tissue on other areas of the body, and that's easily a determining factor because if there's not tissue to move, it's hard to do a reconstruction that way. Probably one of the other big determining features is whether we're reconstructing one breast or two breasts. Over the years, especially with increasing identification of genetic markers for breast cancer, there are more and more women who undergo mastectomy of both breasts at the same time. So of course, if you're trying to reconstruct two breasts, you need double the amount of tissue, and often that's not available. So for those patients, it's often much more straightforward or more appropriate to be able to use breast implants for reconstruction.
So at what stage would a woman have to decide what choice she wants to make? Is it at the time of a mastectomy, for example? Or can there be a delay to say, you know what, I'm going to do my mastectomy first, let's revisit this at another time? Or what is the timeline of those decisions?
It's a great question, and one that women will struggle with sometimes in trying to make a decision. Often patients, if a woman wants to have reconstruction at the same time as having her mastectomy, we call that immediate reconstruction. And patients who will do that are often women who perhaps are having preventative mastectomies or having mastectomies where the disease is found at a very early stage, where there's lower likelihood for having to have chemotherapy or radiation therapy afterwards. Sometimes a woman who's just been diagnosed with breast cancer has so much to deal with in trying to manage that diagnosis and figure out how they want to be treated and what are the different options for treatment that adding the whole concept of discussing breast reconstruction at the same time can be overwhelming and difficult. Or a person may not be sure that they really want to undergo reconstruction. But doing it at the same time is common. If a woman chooses not to do that, they can have reconstruction at any time afterwards. And it doesn't really impact the outcomes. We can do very nice reconstruction 6 months later, a year later, 10 years later, when a woman decides that she's ready or it's appropriate for her.
Absolutely fascinating discussion. Thank you so much for this insight. We really appreciate it.
It's my pleasure. Thanks for having me.
Thank you very much. If you'd like more information about breast implant or reconstruction options, just go to our website. That is yourmorning.ca.